Hi everyone, good morning, good afternoon, good evening. Welcome to today's GSNMH session, and it's my pleasure to introduce our guest speaker, Dr. Rajvi Chaudhary. Dr. Chaudhary is a recent graduate of BJ Medical College, now preparing to begin her journey as an internal medicine resident. She brings with her not only a strong foundation in medicine, but also a growing passion for research, currently collaborating with Mayo Clinic to further her academic and clinical aspirations. Beyond the white coat, Rajvi has a quiet love for words. She is an avid reader, a reflective writer, and the author of a medical blog, as well as two recently published short novels, each reflecting her curiosity and compassion. At the heart of it all, Rajvi believes that the essence of life lies in balance between ambition and stillness, achievement and peace, knowledge and human connection. Her path in medicine is guided by the hope that the healing patients can also inspire a softer, more mindful way of living, one where dreams and serenity walk hand in hand. So over to you, Dr. Rajvi.
Thank you very much. Thank you for introducing me. It was a great introduction. Hi, everyone. Myself also, Rajvi Chaudhary. Uh, I know today's topic is about health issues and mental health issues with USMLE journey. So I know everybody posts about statistics and depression this, anxiety this, and all. But I wanted to start not with the statistics, but with a little bit of silence. Imagine yourself alone in a quiet room, and the only sound that you can hear are turning of pages, the clicking of flashcards, and your beating heart and your anxious heart that is counting hours until your exam day. Right? That is the reality of USMLE. A dream of healing wrapped in the weight of uncertainty. So, a pursuit of knowledge that is shadowed usually and always with self doubt, a path that is walked with courage, but most often in solitude. We have gathered here today not to glorify the struggle or deny its importance, but to speak of what lies beneath it, right? The mental health toll or the quiet suffering that goes so often unnamed and unrecognized. Because to chase a dream is beautiful, but you can just as easily lose yourself in the process. Your family is a hard and long journey, and to not lose yourself in the journey is what we all want to do. United States has become like a beacon for those who wish to practice medicine at the highest levels, and the allure is undeniable. And advanced training, vast opportunities, the ability to touch lives with cutting edge science. But every dream carries a shadow, and the shadow of your family can be heavy sometimes. So these exams are not simply academic hurdles, but they are gateways. They decide where you may practice, what specialty you may practice, and the stakes are immense. So, what should be a celebration of learning often becomes a test of survival, right? We tell ourselves that, 20 more questions, 40 more questions, one more late night. And after all of this, at some point, we might start losing ourselves. So, we all know that there are stressors in this USMLE journey. And just to name a few, academic pressure, it's one of them, obviously, but it also comes with social isolation, the uncertainty, and not to say, but the financial strain, obviously. Academic pressure, it is the vast knowledge, and the bar is obviously set so high. One exam, it feels like it may make or break your career, and the weight of the whole exam is very high. Financial strain, as I said, all of the steps, one, two, three, your OET exam, everything is thousands of dollars, and not to mention your electives, observerships, the travel, your applications, and it just keeps adding up. So that can be a source of stress to people, right? Social isolation. Now, as I said, 20 more questions, 40 more questions. And in all of that, people start withdrawing from whether it be like a missed dinner with friends or not going to families, not going home. The student is always absent if you're preparing for an exam. Social isolation can be a bit of a stress to people as well. And apart from all the uncertainty, after all, like you've done everything right, you've given all your exams, you've scored very well, still the uncertainty, it hangs over you. Like that is the biggest stress, I think, of all. the uncertainty of not knowing if you will be good enough, to the program directors, to the residency programs. So all these burdens you have to face alone as a USMLE aspirant, and I think it can be a bit of a stress. And all these stressors, they usually translate into health consequences, but also mental health issues, right? And to name a few, the mental health issues can be from burnout, anxiety, depression, sleep disturbances, and the main thing like imposter syndrome. That is one of the things that you can say, right? So emotional exertion, depersonalization, the sense of no matter what you do, you will never be enough in somebody's eyes. Uh, that causes burnout. Like some years ago, we used to hear that, oh, practicing physicians, they go through this burnout phase. But nowadays, we are seeing it even in students, even in very early career students, because the exams have become very competitive and everything is very stressful, right? That causes anxiety and depression in students as well. The studies have shown that nearly one third of medical students are depressed, and the exam related anxiety is even more than one third. So it's a bit of an issue that needs to be addressed. um, Sleep disturbance, yes. So all the medical students, we are caffeine fueled, we have restless mornings, and sometimes the dreams are haunted with neat PG questions and new world questions, and that can cause sleep disturbances as well. So after all this, if you don't get enough sleep, that can translate into mental health issues. Sleep disturbance can have other health issues as well. And the imposter syndrome, again, like the whisper in your head saying like you are not good enough, you don't belong here. That is something that needs to be addressed as well, right? Also maladaptive coping, like too much caffeine, again, too much stimulants, food binges, and all of this translating into health issues. That is causing the medical students to have other mental health issues, as I said, depression, anxiety, etc. So, all in all, the toll is not only academic, but also on your health, on your body, and on your mind, right? And the added burden that IMGs, the international medical graduates, face as compared to the USMDs or the USDOs, that we have to jump through many more hurdles than they do, right? Because they don't have to go through the whole maze of ECFMG certification, the whole thing of like, oh, you are international people, you don't know what we do. So we have to jump through more hoops than them to get matched, right? The uncertainty of visas, the loneliness of again staying far away from home. You don't know anybody in a different country, in a different city, and staying very far away from family. That alone is a bit of a, not a bit of a, much big of a stressor to people. Again, the financial constraints that come with that, right? You are leaving your home, you're going outside and living there. So everything like doubles, triples. The cost is very much of living outside. So all in all, the quiet ache of identity comes, right? Feeling like an outsider. You have to fight to prove that you are the one, you are the one who's worth to be in the system. So all of this translates into a very overwhelming and as I can say, a burden of a to somebody's mental health, and everybody needs to be supported in this time. Everybody needs to reach out. Everybody needs to cope. Everybody copes differently. So there is also a science of coping and recovery that can help people. So as we turn to exercise or mindfulness or structured schedule, journaling, whatever helps you, you need to do that in order to stay on top of your mental health, because that is something you don't want to neglect, right? So science has proved again and again that exercise is very important for mental health. Like a 20-minute walk or a simple jog can help reduce your cortisol levels and help increase your sleep patterns and help increase your REM sleep. So exercise is one of them that helps me a lot as well. Mindfulness, if somebody is into meditation or journaling or just breathing exercises, that can be very helpful. Structured schedules. Again, this has helped me a lot, a lot, a lot. I cannot mention how much this has helped me. just writing out things that you have to do, and not getting, the whole burden of not remembering the things you have to do, and then getting lost in uh, all of the uncertainty of things that you have to do. That the structured study schedules help a lot. Peer support, that is something you cannot neglect. Again, study partners or online groups, WhatsApp circles, just hearing, like, just seeing a text like, oh, me too, I'm having this issue as well, so that helps, that you are not alone in this struggle, somebody else is having the same problem as well. I know this sounds negative, but yes, seeing that somebody else has this problem helps you sometimes a lot. And professional help, that is something also that can help very much. Therapy sessions, counseling, any type of psychiatric support that you can get through this whole journey. So just the part of recognizing that this is the point that you need help, or this is the point where you should start seeking help, is very important. That is not a sign of weakness, it's usually a sign of wisdom. And if you feel like you are not able to cope on your own, just get some professional help. That would be very wise, because doctors or medical students are always humans first. You don't need to neglect the fact that you need help, right? That can help a lot in your journey. Again, a good mental health is equal to a good individual, and that can help in your academics and your overall health very much. So I think not ignoring that should be very much useful. And all in all, the thing that I want to conclude with is USMLE is just a measure um, of how, not as a person you are, right? It is more than a score. USMLE is not like how much you can recall. It is more about how you are as a person, how compassionate you are as a person, and not like none of the scores can define you. So you don't have to drown in the pressure of the exams. Just it can mark you can mark your answers, but none of the exams can mark your courage, your humanity, your compassion. So don't lose yourself just in the struggle of getting good graces or good grades. And perhaps the first lesson of medicine will be, before you can heal the world, you must heal yourself. So never, never, ever, lose yourself in the whole process. That's the main thing I wanted to share.
That's
Thank you.
amazing. That's amazing. Thank you so much, Dr. Rajvi, for sharing your journey and insights with us today. Your story of balancing rigorous medical training with a passion for research and writing is truly inspiring. You have reminded us that medicine is not just about the science and skills, but also about finding harmony between ambition and stillness, knowledge and human connection. Let's all take a moment to appreciate the wisdom and openness Dr. Rajvi brought us to this conversation. Thank you once again, Dr. Rajvi, and thank you for being part of this. And here we are signing off and hope to see you all again. Thank you.
Yes, thank you so much for giving me the chance to do this. I loved it very much. I loved mentioning my ideas out to the world. Thank you very much.
Thank you, Dr. Rajvi.